Hi, I'm Dr. Zoya from Trick One Aesthetics and Skin Clinic, and today I'm going to be talking to you about the do's and don'ts after toxin or Botox treatments. So I'm going to break down all of the aftercare for you. Okay, so let's break this down into four main categories. So what not to do immediately after, 4 hours after, 24 hours after, and for 2 weeks. Firstly, immediately after, you're going to be really tempted to touch the area, massage the area. You're going to have a few bumps on your skin that go down in about 20 to 30 minutes. And you're going to be tempted to want to cover those with makeup before you leave the clinic. But that's an absolute no-no. So don't touch the area at all and don't put any makeup on the area. The reason for this is all to do with infection control. In the first few hours after you've had your Botox treatment done, you've got tiny, tiny little microscopic wounds where the needle has been. And these are entry points for infection. So if you touch it with dirty hands, that can lead to an infection, or if you put dirty makeup on there that's been sat in your bag for weeks or months, that can also cause an infection. And a bonus point of something that you should do after is considering the area that you've had treated. So say it's your forehead and frown and around the eyes, then you've got to try and move that muscle in the first hour. So raise your eyebrows, look angry, smile lots. If you've had your jawline treated, then chew on a piece of gum for the first hour. What this does is really helps that toxin or Botox really get into that muscle much quicker. So for the next 4 hours, you want to remain upright. You don't want to be lying down, lying on your face, on your side, upside down, yoga, whatever. You don't want to be doing any of these things because you want that Botox to stay where it's been placed. So next, for 24 hours after the treatment, you don't want to do any exercise. When you're exercising and moving around a lot, you might displace that toxin from the muscle that it's in to a nearby muscle in the area. So you just want to avoid any sort of exercise or any strenuous exercise for the first 24 hours. You also want to avoid any excessive alcohol for the first 24 hours. This is for a couple of reasons. Firstly, when you have alcohol, you can have a glass or two, but when you have a lot of alcohol, it affects your liver. And when it affects your liver, what it then does is it impacts the way your blood clots. So you wouldn't notice this yourself day to day, but where you've had injections in certain areas of your face, that area is more liable to getting bruising. And if you've then had alcohol, which then alters the way your blood clots, then you can end up getting more bruising. So you want to avoid any alcohol for the first 24 hours. And then for the first 2 weeks, there are a few things you want to avoid. So it takes a good 2 weeks for most types of toxin or Botox injections to fully integrate and fully work in your system. So for that time, you don't want to do anything that's going to move that Botox from the very small and delicate area that it's been placed to any nearby muscles. This is because if it moves from one muscle to the other, you can get things like an eyebrow droop or an eyelid droop or a wonky smile, because the muscles that we're placing this toxin in are very precise and very intricate and small. So, for example, you don't want to have a facial done where your face is being moved and, massaged and all that for the first 2 weeks. Similarly, if you're going to be getting your eyebrows threaded or waxed, you don't want to be moving around the eyebrows and that whole area if you've had that region treated. Also, you don't want to have any other sort of devices on your face like ultrasound therapy or radio frequency or any other type of device, lasers, etc. on the areas that have been treated for the first 2 weeks. Thanks for watching the video. I hope you find that useful. Please like and subscribe.